Welcome back to another episode of HealthCap Weekly Wrap. This week, we're talking about rising respiratory virus trends, what's really going on with sinus infections, practical infection control strategies, preventing multidrug-resistant organisms, and what Gen X health trends mean for the future, plus a quick but meaningful reminder about hope and well-being.
All right, let's jump in.
So first up, this comes from Argentum, and it's called From Sniffles to Serious, Understanding Respiratory Viruses This Season.
Yeah, and this one really sets the tone for everything else we're going to talk about today.
Exactly. This isn't just a general overview, it's really a snapshot of what's happening right now with respiratory viruses across the country. They're pulling from CDC data and looking at COVID-19, flu, and RSV trends.
Right, and one thing that stood out to me is how much these trends shift week to week. Flu activity, for example, has been changing pretty quickly in certain regions.
Yeah, and they also talk about severity levels and how those are trending, which is important because it's not just how many cases there are, it's how serious they are when people get sick.
And vaccination comes up too.
It does. Vaccination rates and effectiveness are a big part of the conversation here. Not in a preachy way, but more as a situational awareness tool, like what level of protection do people currently have?
And then there's that environmental piece, which I think is really relevant for our listeners.
Oh, yeah. The article points out that colder weather and more time spent indoors really drives transmission. And when you think about senior living communities, that's huge.
Exactly. Residents are spending more time indoors together, staff are moving between different areas, families are visiting. It creates more opportunity for viruses to spread.
So the takeaway here for operators is really awareness.
Yeah, awareness and responsiveness. Knowing what's circulating in your region, staying connected to public health updates, and being ready to adjust practices as things shift.
All right, let's stay in that respiratory lane for a minute and move into our second story. This one comes from the American Academy of Family Physicians, and it's their clinical recommendations on adult sinusitis.
Yeah, this is a really practical one.
It is, and honestly, it helps clear up a lot of confusion because not every sinus issue is the same.
Right? The big point here is distinguishing between viral and bacterial sinus infections.
Exactly. Most sinus infections are viral, which means antibiotics are not going to help.
And that's where things can get tricky in a senior living setting.
Totally. Because you've got residents experiencing symptoms like congestion, pressure, maybe a cough, and it can feel like something that needs immediate treatment.
But the guidance here says to look at things like duration and severity.
Yes. If symptoms are mild and haven't lasted very long, it's likely viral. If they're severe, persistent, or getting worse after initial improvement, then you might be looking at bacterial.
And that's where antibiotics could be appropriate.
Right, but the key is not jumping to that too quickly.
Which ties directly into something we'll talk about later with antibiotic stewardship.
Exactly. Overuse of antibiotics can lead to resistance, which becomes a much bigger issue down the road.
So for senior living professionals, the takeaway here is really about clinical decision-making and communication.
Yeah, helping staff understand the difference and also helping residents and families understand why antibiotics might not be prescribed right away.
All right, now let's shift into operations. This next piece comes from Staples Business, and it's called 4 Proven Infection Control Strategies to Protect Residents and Ensure Compliance.
And this one is very action-oriented.
It really is. They outline 4 specific strategies for senior living communities, and the first one is elevating housekeeping staff as frontline partners.
I love that.
Yeah, because housekeeping teams are often underappreciated, but they are absolutely critical to infection prevention.
They're in every room, they see everything, and they're directly impacting cleanliness and hygiene.
Exactly. Treating them as part of the care team, not just support staff, makes a big difference.
The second strategy is implementing strong cleaning and disinfection protocols.
Right? And not just having them, but monitoring them.
Yeah, consistency is key here. It's about making sure protocols are followed every day, not just during an outbreak.
Then there's improving community design and infrastructure.
This one's interesting.
It is. Things like layout, airflow, and high-touch surfaces all play a role in how infections spread.
And while you can't always redesign a building, you can make adjustments.
Exactly. Even small changes can reduce risk,
And the fourth strategy is strengthening vendor partnerships.
which might not be something people immediately think about.
No, but it's huge. Having reliable access to cleaning supplies, PPE, and other essentials is critical.
Especially during times when demand spikes.
Right. And the guide really emphasizes that consistent operations across all these areas help support compliance, reduce risk, and ultimately protect residents and staff.
So the takeaway here is that infection control isn't just clinical, it's operational.
Exactly. It's built into daily routines and systems.
All right, now let's go a little deeper into infection prevention. This next resource comes from AHRQ, and it focuses on key strategies for preventing multidrug-resistant organisms in long-term care.
Yeah, this one is more structured and clinical.
It is, and they outline 4 main strategies: protecting skin and preventing infection, reducing MDRO transmission, using antibiotics wisely, and cleaning high-touch surfaces.
Let's start with protecting skin.
Skin integrity is a major factor. When skin is compromised, it creates an entry point for infection.
So things like pressure injury prevention and proper wound care are essential,
Exactly. Then there's reducing MDRO transmission.
which includes practices like hand hygiene and appropriate precautions.
Right, and this is where consistency really matters.
Then we have using antibiotics wisely.
This ties directly back to the sinusitis discussion.
It does. Antibiotic stewardship is critical in preventing resistant organisms from developing.
And finally, cleaning high-touch surfaces.
Things like doorknobs, handrails, and shared equipment.
Exactly, these are the areas where pathogens can spread quickly if not cleaned regularly.
So for senior living communities, the big takeaway is having a comprehensive approach.
Yeah, it's not one thing. It's a system of practices working together.
All right, let's shift gears a bit. This next report comes from the Mather Institute, and it's the Xperience Year 2 report.
And this one is a little different, but really interesting.
It is. This is the second year of a 5-year study looking at the health and wellness of Generation X.
So people who are, not in senior living yet, but getting closer.
Exactly. And what's interesting is what they're experiencing right now. High stress levels, challenges with mental health, and a mix of healthy and not so healthy behaviors.
They also look at wellness trends and technology.
Yeah, and adoption is mixed. Some are really engaged, others are hesitant due to cost, privacy concerns, or just lack of interest.
There's also a workplace wellness component.
Which makes sense because many in Gen X are still working.
And environmental factors too, like how home environments impact well-being.
So why does this matter for senior living?
This is your future resident population.
Exactly. Understanding their current health behaviors and attitudes helps communities prepare.
And it also highlights opportunities,
Like what?
like offering wellness programs that align with their preferences or addressing stress and mental health more proactively.
All right, and finally, let's end on something a little lighter. This comes from the Mather Institute as well, and it's the Hope for Health flyer.
Yeah, this one's a bit older, but still really relevant,
It focuses on how hope impacts health and well-being.
which might sound simple, but it's actually pretty powerful.
It is. The research shows that people who are more hopeful are more likely to engage in healthy behaviors and feel positive about the future.
And they give 10 practical tips.
Things like setting realistic goals, breaking them into smaller steps, finding purpose, staying socially engaged, and even practicing gratitude or reflection.
And this is something that can absolutely be applied in senior living communities.
Oh, for sure. Programming, resident engagement, even staff interactions can all support this idea of building hope.
And it doesn't have to be complicated.
No, small, consistent efforts can make a big difference.
So the takeaway here is that well-being isn't just physical.
Exactly. Emotional and mental outlook play a huge role.
And that's something every community can support.
All right, that's all for this week.
Thanks so much for tuning in, and we'll see you next time.
And don't forget, you can get more details about these stories in the weekly roundup on Angie's blog, at healthcapusa.com/Angie's-blog.